So it's a pleasure to be here, and thank you guys for coming in to hear. There is actually a lot of synergies between what's been happening in Brazil and our story in Vancouver. And it began really with us in 1991 when I started working in a hotel very similar to the housing that Braços Abertos is using now in São Paulo to place the 500 crack users from Cracolândia, which is why I know these guys, because over the last few years I have had the privilege of going down and working both in São Paulo and in Rio with Viva Rio and Project Proximidade, as well as in São Paulo with Braços Abertos and the staff there. In Vancouver, we took over a hotel in 1991, which we effectively occupied and filled with people who used active drugs. And it was the first time a building was housing people who were openly using drugs, and where the staff were aware of it and supportive and working with people to try and help them achieve better health outcomes and more stability. So it was a weird model at the time and quite controversial. And that was when our first relationship with the police came out. And I would say that back in 1991, the police just really didn't understand what we were doing. Why were we not kicking people out for using drugs? Why were the staff helping people why did the staff handle Narcan back in 1991? That was considered extremely controversial. And we were doing CPR training for the staff. So the focus of the project was to produce stability in people's lives, not to kick them out, but to try and actually intentionally stabilize people's lives. That one hotel with 70 people that was so controversial back then in the early 90s actually did sort of redefine in many ways the policy for our housing provincial government in Vancouver, that then later went on to purchase 27 hotels and then hand them out to other NGOs to try and deal with the crisis of homelessness in our city. And a huge part of that crisis, obviously, is people who actively use drugs. And interestingly, the city adopted this 4 pillars framework: harm reduction, enforcement, treatment, and prevention, as a way of embracing harm reduction, predominantly to take on the fight to open the injection site. However, to some extent, that was as important as a mantra to look at in terms of everything else that was going on in Vancouver to deal with addictions and to treat and see people who use drugs, not just in sight. It was also important as a framework to think about how we were delivering healthcare. How were our primary care services being delivered? How were people being housed? What was our housing provincial ministry doing in terms of housing policies? So the public conversation in our city was extremely important. Police initially were very reticent and very aggressive. They used to attend every overdose. The drug users movement, of course, in our city mobilized. We worked very closely with the drug users, and as part of that sort of constant public discourse and education, and I would argue as well by just doing services and occupying those spaces with people that were using drugs, we shifted that relationship significantly. Whereas now, if you go and talk to a police officer in Vancouver, they will say our job is to police public disorder, not to make decisions about how healthcare is provided. So we don't see it as our job to say yes or no to something like supervised injection, or whether or not drug users are welcome into primary care services. But if people are openly injecting on the street, we will send them to the injection site, or we will divert them to a service, because that's what policing work is meant to be about. And I recently had a group up in Vancouver from the US, a bunch of folks from communities where police don't do that. And they were absolutely shocked and almost like they were all taking selfies after with the police. Like they couldn't believe that this police officer was so non-violent in his approach towards policing drug users. But I would say that it has taken 25 years of ongoing discussion, advocacy, activism, and public debate to get to that point.